Hey, Mrs. F, how's it going today? How you feeling?
I'm doing a lot better, thanks. That cream you gave me really helps. I feel like it made a difference right away.
Good. I'm glad to hear that. So you're feeling better.
Yes, I am.
Good, good.
Um, I was just curious, why did the infection happen in the first place?
The infection happened in the first place because you do have the area on your lower abdomen where you have the extra skin, the pendulous skin we talked about, and the skin fold, the two skin surfaces. What they do is they kind of rub together. There's a certain amount of friction and moisture that occurs between the skin folds, and when there's moisture and warmth in a dark area and a lot of friction going on, what can happen is it can lead to skin breakdown, which then puts you at risk for developing an infection in that skin fold. Those areas would be the lower abdomen for you. A lot of people experience those issues under their breasts, in the axilla, the groin, and things like that. Any area where there's two skin surfaces that kind of tend to rub together and moisture can accumulate, and you're at a high risk for developing an infection.
Oh, okay. Is there anything special that I should be doing to protect my skin from an infection?
There's a lot of things that you can do to protect your skin from a recurrent infection. The most important thing that you can do is remember that you need to keep those areas with the skin folds clean and dry at all times. And what that means is you need to be making sure that you're bathing regularly, which I'm sure you do. Uh, when you're done bathing, it's very important to make sure that you use a clean, dry towel to dry all of your skin folds thoroughly so there's no moisture left in between. A lot of people find it very helpful to utilize over the counter products like Gold Bond powder, Columbia powder, talc powder, things like that. And you sprinkle a small amount in the areas where there might be friction, rubbing, or moisture that accumulates throughout the day. And that typically alleviates a lot of the symptoms as well. And so a lot of people utilize those types of products. It's important to remember that you should be wearing supportive undergarments, to prevent that from occurring under your breasts because you are at risk in that area as well. But mostly the most important thing you're going to want to remember is you need to keep those areas clean and dry at all times.
Okay, thank you. What about clothing?
Clothing does make a difference. I do typically tell my patients to try to avoid utilizing clothing that has really tight waistbands or any areas that are going to be rubbing and causing friction. It's always smart to choose fabrics that are made from natural materials like cotton. Cotton is a nice natural material and it wicks moisture away from the skin, encourages ventilation, and it's nice and breathable. It's good to think of making sure that you avoid synthetic materials and materials with lots of artificial dyes, but those can be irritating to the skin as well. And like I said, making sure that you're utilizing supportive undergarments as well. Those are all really important things that you can keep in mind when you're selecting clothing to protect your skin.
Hmm. Maybe I should just have it cut off the skin.
The skin, having it removed, you do have that extra skin like we talked about. Anytime you go through a period of rapid weight loss like you have gone through, you do develop a little bit of extra pendulous skin, especially with your age. Your decreased collagen and the elasticity in your skin is definitely a lot less now. You're going to start to notice those areas can be a little bit more pendulous than normal, which leads to the skin folds and puts you at risk for infection. Now, it's always an option to have the excess skin removed. A lot of people after weight loss surgery do opt to have the excess skin removed by a plastic surgeon. Unfortunately, surgery is not without risk. You are at risk for bleeding, infections, blood clots, and things as serious as death from surgery. So we like to try to avoid that if at all possible, which is why I'm going over all of these alternative measures with you. If we can utilize some of these techniques to help to prevent you from developing recurrent infections, then that's great. Down the road, if you find that the skin is becoming cumbersome, it's bothering you, and we're having issues with these recurrent infections, then we can most definitely talk about referring you to a plastic surgeon to talk about having the excess skin removed.
Okay.
Okay?
Yeah, that's fine. Thank you very much. Thanks for your help.
Anytime.
You,
Did you have any other questions for me?
no, I think this cover everything. I think you did a really good job. Thanks for your help.
Good. I'm glad that everything was clear for you. Sometimes it does feel like you're remembering everything now, and then you get home and you're like, oh darn, I wish I had asked her this, or I wish I had asked her that. So I do have a handout for you to take with you when you go today. It does list a lot of the techniques that we talked about and a lot of the products that we discussed a few minutes ago here on the handout. And there's also the number to the office at the top. So if you come up with any questions or concerns regarding this or anything else that we've talked about today, you can go ahead and give me a call and I'd be more than happy to go over it with you.
Okay, thank you very much.
You're very welcome. I'll walk you out, okay?
Okay, thank you.
No problem. Take
Bye-bye.
care.